in overt disease with a large number of tumor cells, simply stimulating the natural immunity cells with this method would lead to increased survival. And so we opted for associated treatments to stimulate the natural immunity, associating other components as well. And one of the first components assessed, and here there are several of them, but we'll just look at panel C. One of them was an anti-epidermal growth factor receptor antibody. These cells express EGF receptors. We have cetuximab, a humanized antibody, anti-ERG. The cells, the natural immunity cells, recognize the cells covered by the antibody and destroy the cell coated with antibody. And I think I can use the pointer. Over here you can see that the antibody alone has very little activity. This is the treatment with the oligonucleotide repeated every day for a certain period of time. When we add in the two treatments together, you can see that there is a considerable increase in survival, although the animals already had initial ascites. But again, this does not lead to healing the disease in a situation where ascites is already present. Conversely, this is the last experiment that I wanted to show you. This is triple treatment. In addition to the antibody, and the oligonucleotide, we also added a chemotherapy drug. And that might seem odd. Chemotherapy drugs have an immunosuppressive effect. How can such a drug increase the anti-tumor response, you may well ask? Probably it is at the level of infection that we best understand this outcome. In other words, if we take tumor cells and we inoculate them in a mouse and then treat the mouse with oligonucleotides and extract the tumor cells from the mouse, you'll see that the cells are more sensitive to chemotherapy. If we take tumor cells and we put them in vitro and add oligonucleotides, then we take the cells and place them in contact with the chemotherapy drug, you'll find that they are equally as sensitive as they were before. In other words, the oligonucleotide has no direct effect on the tumor cell. However, it does have effect insofar as it stimulates tumor immunity. It's not yet well defined, but probably to defend against viral infections and bacterial infections and to defend ourselves against infections in general, all the cells that present abnormalities in their DNA are somehow deriving from the inflammatory response and made less able to repair damage induced at the DNA level. Treatment with oligonucleotides is a physiological element, at least during the inflammation process, so that all of these cells become more likely to die if their DNA is damaged, so that all the infected cells, etc., no longer have the repair mechanism. If we do all this before chemotherapy, then obviously the cell will be less able to repair the damage. If chemotherapy causes DNA damage, the treatment will be more effective than treatment without oligonucleotides beforehand. So essentially I'm saying that the inflammatory process due to infectious agents does lead to cancerogenesis. It does carcinogenesis. It may lead to the production of factors that may cause an increase in tumor cell growth. However, the inflammatory process, the infectious inflammatory process, may also lead to an increase in the immunological response, in the immune response. And this increase in the immune response, if it can be controlled adequately, may also lead to activating cells that are capable of destroying tumor cells. For the time being, the relationships between these two opposing processes, but still similar processes, is not well understood. And that's it. Thank you very much.
Grazie professore.